When should you get your flu shot?
Technically, it's never too early to get a flu shot. Most flu supply starts to come in mid-September, and officially the flu surveillance season starts early October. So anytime after mid-September, early October is a good time frame. You don't want to go too early because there is some data showing that the efficacy may wane off after 2-3 months, especially with the senior population, because their immune response sometimes is not as robust when they get the flu vaccine. So it's best to wait till early October or late September to get your flu shot. And for the seniors, for that reason, they have come up with this high dose flu vaccine. Because earlier when this was not there, a lot of the doctors were starting to recommend, oh, you got your flu shot in late September, let's go get you another shot in January. And it's just the inconvenience, go twice, get another shot. So they came up with this high dose flu vaccine for the seniors so that they get a higher dose that builds a stronger response in their body that lasts throughout the season.
When it comes to COVID and flu together, if I'm still doing the stay-at-home order, kind of really being protective, should I still get my flu shot?
Yes, everybody should get a flu shot. And the reason being, even if you're staying at home, there's always an opportunity for you to get exposed, whether somebody coming to your house or you going out for whatever reason, anything important, even a grocery trip or having to go to work for some reason. Flu gets pretty prevalent every year. And there have been instances that people that are generally homebodies still get the flu because they had an exposure from somebody that came to visit. And we don't want to take that chance with the flu, especially when COVID's around. So take the flu vaccine. I know it's an inconvenience for like one time, but it protects you throughout the season. And given that this year it's going to be hard to differentiate whether you have flu or COVID and you're going to have to go get a test, why not just get the vaccine and not have to worry about that?
Are there any indications, any way to predict kind of what type of flu season we have coming forward?
In the Southern Hemisphere, so in Australia, New Zealand, and all these places, it's been a somewhat of a milder flu season. There's been a lot of talk that there was that stay-at-home mentality in place. People are being more cautious about hygiene. They're washing their hands more often. They're staying away from people 6 feet or more. And then there's a lot of people that are wearing masks. So all of these things combined are having an impact on the flu, just as they have had an impact on COVID. And of course, we have flu vaccine available. I mean, in the Southern Hemisphere, they've had their season, they've used their vaccine, and now our vaccine is arriving because our seasons are arriving. So we need to do all those hygiene measures, and hopefully we'll have a milder flu season. We still expect a surge in COVID cases, but if we can continue to practice all these good hygiene measures, maybe we'll get a milder surge, and then COVID vaccine will be here, and we'll get back to whatever normal we're going to have.